Hello everyone, myself Dr. Mahesh Kumar and today my lecture on topic Hematuria. Hematuria means the blood in the urine. In this topic I will cover मूत्र में रक्त का आना, इसके कारण, लक्षण, प्रकार और निदान. Before going to detail, you know that the term hematuria is made up of two words, hemat and uria, which means the blood in the urine or appearance of blood in urine. In microscopic hematuria, urine color seen red, while in microscopic hematuria, in this the RBC count in urine is more than 3 are equal to 3 per HPF. In hematuria cases, the urine becomes appear like tea color, it's slightly smoky, reddish, frankly blood depends upon the amount of blood in urine. And the hematuria commonly seen in renal disease, renal stone, ureteric stone, renal cell carcinoma RCC, and also in trauma, papilloma of kidney, infection of kidney and or urinary tract, polycystic kidney disease, renal tuberculosis, etc. What are the types of hematuria? The hematuria can be classified on various ways like gross hematuria and microscopic hematuria. In gross hematuria, the hematuria visible in by aided, unaided eye or by naked eye. The red to straight brown or chocolate urine creams, clots may be present. In microscopic hematuria, this only detected only by microscope. When the clinically more than 3 to 5 RBC per high power field HPF are visible under microscope, then it is called microscopic hematuria. The second one is the category of early hematuria, terminal hematuria or diffuse hematuria. In early or initial hematuria, the causes are like urethral virgin or distant to external sphincters of the bladder. The terminal hematuria means the problem existed near to bladder, neck or prostatic virgin, and the hematuria comes at the end of the act. The diffuse or total hematuria, in this the blood came throughout the urination and the source is in the bladder or upper urinary tract. The another classification is the false hematuria or silent hematuria. False hematuria is discoloration of urine from pigments such as food coloring and myoglobin, and sometimes confusion with hematuria, like a patient taking rifampicin, then orange red colors urine seen, which is not actually a hematuria. The silent hematuria, in this this occurs due to the tumors of kidney or bladder unless proved otherwise. The next types or category of the hematuria is according to involvement of glomerular apparatus or extraglomerular apparatus. The glomerular bleeding and extraglomerular bleeding are important to differentiate when going to diagnose the cases of hematuria. The glomerular bleeding have red, smoky, brown or coca color, while the extraglomerular bleeding have red and pink color. The clots are absent in glomerular bleeding, while the clots are present in the extraglomerular bleeding cases. The RBC cast may be present in glomerular bleeding, while the RBC cast absent in extraglomerular bleeding. The RBC morphology are dysmorphic RBC in glomerular bleeding, and the RBC morphology are normal in extraglomerular bleeding. So, in summary way, the glomerular bleeding have red, smoky, brown or coca color urine, clots are absent, RBC casts are may be present, and RBC morphology are dysmorphic in nature. The another one is the renal hematuria. The term renal hematuria means the bloods come from upper excretory or urinary tract, and the urethral hematuria means the blood came from lower urinary tract. The vesicle hematuria means it is due to the urinary bladder causes like cystitis, stone or carcinoma at the urinary bladder site. Now, second heading is what are the causes of hematuria. There are various causes described in hematuria cases like causes located in the kidney or in the ureter or in the urinary bladder and prostate region or in urethra. If the causes existing in the kidney, there may be etiological factors like infection, infarction, injury, tumors, stones, or congenital polycystic kidney or polycystic kidney. In the kidney, there is chances of infection like acute glomerulonephritis or tuberculosis that may result into hematuria. In kidney infarction cases, the massive hemolysis with acute renal tubular necrosis are seen, and it mismatched blood transfusions are the causes. Sometimes kidney injury in road traffic accidents or in blunt trauma occurs, which also causes the hematuria. The tumors, the Bill's tumors, which are also known as nephroblastoma, occurs below the year of 3 to 4 years in children. And another one is the renal cell carcinoma, a malignant state of the kidney which is showing the painless hematuria. The transitional cell carcinoma is also causes of hematuria. Stones in the kidney, mostly oxalate stains or triple phosphate stains that causes hematuria. The polycystic kidney disease is a cystic disease of the kidney and may occur congenitally, or multiple cysts may develop in later. So they may, when ruptured, causes the cyst when ruptured causes the hematuria. Next, the causes which are mostly seen in ureter are like stones or cancers of the ureter side. Stones, mostly the renal origin, which when passing through the ureter towards the bladder, they may cause injuries and create hematuric conditions. The causes in the urinary bladder site are the most common causes like carcinoma of the urinary bladder, carcinoma of the prostate gland, stone in the bladder, chronic inflammation or infection of the bladder like cystitis, chronic tuberculosis of the urinary bladder like tuberculosis of the urinary bladder, and the cases like benign prostatic hyperplasia. The urethral causes are maybe due to urinary tract infection, severe urethritis, and the most common is the stone when passing through the urethra. The other rare causes are less common causes like history of sickle cell anemia, history of bleeding disorders, or history of taking blood thinner drugs like anticoagulants, aspirin, etc. Sometimes the confusion or other causes also seen in hematuric patients like contamination in menstruation in female, in purpurium stage in female, internal trauma in urinary tract, and due to vigorous exercise the kidneys or urethral organs may ruptures or injured and causes hematuria. So these are the causes of hematuria which are summarized here. The appearance and fact. The color of the urine seen and their appearance shows many clues towards the diagnosis. Like if the urine bright red blood are seen in urine, then it is mostly due to the lower urinary tract disease. If the profuse bleeding seen in hematuric patient, then the chances of papilloma occurs. The altered blood if present in the urine examination, then the disease mostly kidney related. If the small quantity bleeding occurs, then the chances of renal cell carcinoma, renal tuberculosis are more. The painless hematuria is mostly in papilloma and carcinomatous conditions of the kidney. Painful hematuria is mostly seen in renal stone or renal calculi and urinary bladder stones, or due to the stone origin. Now, how to diagnose a case of hematuria means the investigations useful in hematuric cases. The primary investigation is the urine examination. The urine examination may be routine and microscopic. It gives major clues towards the causes of hematuria. Worm-like clots, growth means growth in ureter, and the pieces of tumor shows the papilloma in kidney regions. This is the causes while going to examine the urine. In urine microscopy, if there is pus cells, then chances of infection, UTI, etc. is seen. If the malignant cells positive, then the RCC or papilloma are considered in most of the cases. If there is maybe parts of stones, oxalates, gravels, and most of the other things may present in routine and microscopics, shows the clues towards the diagnosis. The next investigation is the plain X-ray kidney, urinary and ureter and bladder region. The plain X-ray KUB is important investigations. It shows the enlarged kidney in cases of polycystic kidney diseases or renal cell carcinoma conditions. The radio opaque shadow in plain X-ray shows the existence of renal stones, ureteric stones and bladder stones. Means that the most of the renal stone or renal origin stones are radio opaque and they easily seen in the plain X-ray KUB regions. This is very helpful in diagnosing the cases of stone due to the appearance of the radio opaque shadow. Next investigation is the blood test, the occult blood test. In this, the occult blood cell red urine seen, then occult blood may be present. If hematuria, if the occult blood tests are positive, it means there is hematuria, and if the occult blood tests are not positive, then examine the patient's plasma and rule out the further causes. Next one is the CBC, complete blood count, to know about the level of hemoglobin, total leukocyte count, neutrophils, polymorphs, lymphocytes, etc. To know about the morphological conditions of RBC, which also give a clue towards the investigations of hematuria. The coagulation profile is also required if there is any bleeding disorders in patients can be excluded or diagnosed. The major investigations which are also helpful in cases of hematuria is cystoscopy. With the help of cystourethroScopy, the urethra and bladder, urinary bladder are examined, and in that case, if there is any growth, any changes in the infective conditions, they can be seen, and the biopsy from that side is also helpful to making the diagnosis. The intravenous pyelography is helpful to diagnose the existing causes or conditions of the hematuria. The ultrasonography is most common investigations done while patient coming in OPD for a problem of hematuria. So USG is an important test to diagnose the stones, to any growth, to any existence of pathological conditions like hydronephrosis or infective phase. So this is very helpful in diagnosing the case of hematuria. Next one is the how to manage the cases of hematuria. The management of hematuria depends upon the causative factors. First of all, diagnose the case properly. What are the exact causes of hematuria must be found. In few cases, no treatment requires. If there is physiological hematuria or hematuria with a small amount and non-significant hematuric conditions are occurs, then there is no need of any more exhaustive attention and treatment. The treatment depends upon according to cause and seriousness of the disease or hematuric conditions depends on what types of conditions or pathological condition exist, like carcinoma, like tuberculosis, like renal stone, like any papillomatous conditions, like infective conditions, cystitis, infections, urethritis, UTI, or any more. So first of all, diagnose amount of urine passed and painful or non-painful conditions, the etiological factors, the prognosis of the disease. On that basis, you plan to treat the hematuria according to causative factors or the cause. And then other drugs are frequently used like antibiotics, hemostatic drugs, and stone breaker test, stone breaking procedures like invasive and non-invasive, and many more to remove the stones. Thanks for your patience listening. I hope that this will able to give a more understandings about the hematuria in the patients. Thanks for your patience listening. Thank you so much.